Hello, everyone. My name is Aaron White. I'm with the National Institute on Alcohol Abuse and Alcoholism. My presentation of this session focuses on trends in alcohol misuse related to coping, both before and during the COVID pandemic. And here I'll give you a very brief overview of my larger talk. So in the last couple of decades before the pandemic in the United States, we were seeing an increase in alcohol use. Alcohol consumption increased by about 10%. This increase was driven more by women than men, because over the past few decades, the prevalence of alcohol use among males declined while it increased for females. And these increases in drinking brought with them increases in alcohol-related harms, including ED visits, hospitalizations, and deaths that were larger for women than for men. Prior to the pandemic, alcohol was playing a role in increases in what are called deaths of despair, characterized by Ann Case and Angus Deaton at Princeton. These are deaths involving alcohol and other drug overdoses, suicides, and alcohol-associated liver disease, all related to despair or loss of hope. Increases in these deaths were initially seen among middle-aged, mostly white men living in rural areas. But in recent years, deaths of despair appear to have increased among large swaths of the population. For instance, in this slide, you can see that alcohol-related deaths had been decreasing among Black men and women and Hispanic men before turning upward in a few years prior to the onset of the pandemic. The reality is that alcohol and other substance misuse is deeply intertwined with mental health, both as a symptom and a cause. So it's simply not feasible to fully understand or address one without considering the other. For instance, we know that more than a third of adolescents with a substance use disorder also have past year major depression. And we also know that about half of adults with a substance use disorder, including alcohol use disorder, have a mental illness of some kind. We know that levels of depression and other psychiatric conditions are increasing quickly, particularly among adolescents and young adults. Alcohol and other drugs are reinforcing, in part because they temporarily reduce emotional suffering. This leads some people to misuse alcohol in a maladaptive effort to cope. Unfortunately, drinking to cope is associated with an increased likelihood of developing an alcohol use disorder. During the COVID-19 pandemic, overall levels of alcohol use in the United States actually did not increase that much once we consider both on-premise and off-premise sales. However, research suggests that perhaps a quarter of Americans increased their alcohol use to cope with pandemic-related stress, and clearly this is concerning. Addressing and preventing alcohol misuse in the United States requires considering the individual in context. People drink because it is reinforcing for them. Understanding what motivates people to misuse alcohol provides clues into the factors that can be modified to prevent such misuse and to help support people in recovery so that they can avoid relapse. Logically, strategies that try to address one issue at a time, such as suicide, opioids, mental health, or alcohol, will be limited in their effectiveness unless they take into consideration their shared causal roots. One simple way to identify people in need of help and to connect them to care is to screen for alcohol misuse during every visit to a healthcare provider. Most adolescents and adults see a physician each year, about 85%, and most are asked at least one question about alcohol use, typically on an intake form. But very few, less than 10%, are asked whether they have any problems related to alcohol, and even fewer, less than 5%, are advised to cut down or given more information. This is unfortunate for several reasons. One is that so few people, about 7.5%, with an alcohol use disorder get treated each year, but also because knowing someone misuses alcohol increases the chances they've been suicidal, misuse opioids, and suffer from depression. For more, please take a look at my longer presentation. Thank you for watching.